Cherie. Despite the global concern over Ebola, local doctors say people need to put this issue into perspective. They say you are more likely to contract and get sick from many other diseases, especially if you fail to get yourself immunized. Tanya Poonswan continues our team coverage with a closer look at the health risks out there, especially as we get into the flu season.
Yeah, that's right. And the flu season just started here in October. It runs all the way through May. And according to the Centers for Disease Control, in 2010 alone, some 53,000 people in this country died from influenza and pneumonia combined. So medical experts say it's okay to be concerned about Ebola. But at this point in time, for most of us, we're more at a risk of getting sick from many other diseases.
Hearing the word Ebola, and many get nervous.
That's very scary. That's why I said, oh my God, who brought the people from there to here? Oh.
But according to local medical experts, the risk of people in Nevada, or let alone anywhere else in the country, getting this disease is still very low.
There's no place in the United States right now where we're going to go around and get contaminated with Ebola.
UMC Chief of Staff Dr. Dale Carrison says even as the hospital is conducting Ebola emergency drills and stocking up in protective gear, the advice to the public is still to protect themselves from other, more common diseases.
We're still going to have more people die from influenza.
And we're in the midst of flu season. The CDC says at least 20,000 people die from that every year. When it comes to the norovirus, it kills between 500 to 800 Americans each year. The disease spreads through infected patients and contaminated food and water. HIV/AIDS, that kills more than 15,000 each year, spreading through bodily fluids and infected needles. And tuberculosis is the second deadliest virus in the world. You may remember a Las Vegas mother and baby died from that disease just last year.
I always tell her to wash her hands and make sure she don't put her fingers in her mouth.
Vina Sims just took her 4-year-old daughter Trinity to get her flu shot this week, a prerequisite to get into daycare.
You don't know what other kids have or what's going on at their home, so it's always good to be, healthy.
And Dr. Carrison says staying healthy is much more important now than worrying about things like Ebola.
Concerns have to be tempered with understanding of the disease and the disease process.
Well, another disease that people are talking about, enterovirus D68. That has killed at least 5 children now nationwide, and no cases have been reported here in Nevada, though. But this week, the Las Vegas Day School sent out a letter to parents saying that they need to be more aware of the symptoms. Coming up at 6, we'll talk with a local pediatrician about the risk of this disease and what families need to watch out for. Back to you.
Thanks, Patron.